Hi there everybody, welcome back to my channel. Today I will be talking about eye floaters. Those pesky little annoying things that swim around within our eyes and can cause us absolute havoc. If you want to learn more about these, then please stay tuned. So if you look at this picture on screen now that shows the relative anatomy and different core components of the eye, you will see that the jelly within the eye, which is called the vitreous, occupies the largest volume of the eyeball. The vitreous is jelly, and what happens to it as one ages is that it gradually liquefies and starts to turn more and more fluid-like. This is because the collagen structures that are contained within the jelly undergo stress over time due to aging, and this naturally starts to degrade the core structure of the vitreous. In certain groups of patients, such as trauma patients and those that are particularly short-sighted, this process can be accelerated. When the jelly, aka the vitreous, starts to degenerate, bits of the jelly start to break away. And as they do so, patients notice these as floaters. Essentially, these bits of jelly are floating around within the eye cavity, casting a shadow on the retina, which we perceive as the floaters. Floaters are more noticeable at certain times. For example, if we look at certain pale backgrounds, or if we look up at the sky. A pathological form of floaters is, for example, in the context of a posterior vitreous detachment, which is when the jelly pulls off the back of the eye and large floaters can be created in the process. This, as previously mentioned by myself in videos, warrants urgent eye care professional attention to try and diagnose the problem and then advise you appropriately. The classic advice that has been given over the years for floaters that are benign, i.e. non-PVD related, is to tell patients that over time these floaters will degrade and break up, get smaller and smaller, and or what will also happen is patients will start to learn to ignore them, and over time they will only be noticeable at certain times. As mentioned, certain backgrounds. This has been the advice that has been given to patients for a very long time. Floaters can be particularly problematic for certain groups of patients, and therefore as a result there has been the onus on developing treatment options that are safe to proceed with and that will give patients a good outcome. In terms of options then for floaters that are problematic for patients, one can entertain a laser vitreolysis. This is essentially where, using a slit lamp machine, the patient's floaters are zapped effectively with a laser beam, and this can be an effective treatment. Another treatment option, but this is a bit more involved because it is actually a surgical procedure, is a vitrectomy. A vitrectomy is when a retinal surgeon will go into the eye and the clear vitreous, which is within the center of the eye, is completely cleared. Now, if you recall from earlier, I mentioned that floaters come from the core jelly component, which is in the middle part of the eye. Well, if you clear all of the jelly and all of its components, then effectively you are getting rid of the floaters. Having said that, when this procedure is carried out just for floaters as an isolated issue, usually not all of the jelly is removed, and what is known as a limited vitrectomy is performed. So there have been reports of floaters recurring in such patients after they've had a limited vitrectomy for floaters. In terms of more natural remedies that patients are always asking about, a promising paper from 2019 looked at pineapple consumption and whether that could be used to try and reduce the number of floaters in patients that already had them. The theory roughly goes somewhere along the lines of patients that consume pineapple, they are ingesting from within the pineapple the enzyme bromelain. Bromelain has been shown, according to this study, to stop floaters from forming as it stops them from aggregating. Moreover, in patients that already have floaters, it can help to dissolve the floaters. So this is only a pilot study that has reported this set of findings. However, it is a promising set of findings that will require more exploration. The other thing to consider with respect to pineapples is the fact that if you're like me, I absolutely love pineapples, particularly the Del Monte brand. So if you get to eat pineapples and it gets to reduce the number of floaters that you are experiencing, then for me this is a win-win. The other thing to note with respect to pursuing more natural treatment options for vitreous floaters is the fact that surgical options and laser options come with risks. Now, one of the biggest risk factors with any intraoperative surgery, such as a vitrectomy procedure, is the risk of theoretic blindness, the risk of a bleeding condition known as a suprachoroidal hemorrhage, which can actually have detrimental, irreversible effects. And also there's always a theoretical risk of an intraoperative infection, which again could be devastating for one's vision. So therefore, these options are not taken very lightly and not jumped to as treatment options for floaters in the first instance, due to the risks associated with these treatment modalities. However, things are considered on a case-by-case basis, and if deemed appropriate, then these options do exist. Developing a personalized treatment plan for patients with floaters is of utmost importance. Now, floaters and quantifying them can be very difficult because it is essentially a subjective phenomenon that is described by patients. However, a group in May 2023, under the leadership of Professor Stagner, have developed a fantastic method whereby objectively floaters can be quantified, and this can help us to understand the impact that they are having upon patients and their activities of daily living, and therefore we can then plan treatment with them more effectively and efficiently. Thank you for watching this video about vitreous floaters. I have explored what vitreous floaters are, when vitreous floaters are pathological in the context of a PVD. I've then touched upon the medical treatment options available for floaters, which include laser and then surgery such as a vitrectomy. And I've also touched upon natural remedies that are mentioned in the literature, however, do require more research, such as the pineapple study. If you've liked this video, please do comment, share your experiences, do share this video, like this video, subscribe, and I look forward to seeing you next time. Take care.